Certified Documentation Integrity Practitioner CDIP real exam questions can make sure you pass the test easily. Share some CDIP real exam questions here. 1. A patient is admitted for chronic obstructive pulmonary disease, COPD, exacerbation. The patient is on 3 L of home oxygen and is treated during admission with 3 L of oxygen. The most appropriate action is to A. Query the provider to see if acute on chronic respiratory failure is supported by the health record. B. Query the provider to see if chronic respiratory failure is supported by the health record. C. Code the diagnoses of COPD exacerbation and chronic respiratory failure. D. Query the provider to see if respiratory insufficiency is supported by the health record. 2. Which of the following is the definition of an excludes to note in ICD-10-CM? A. Neither of the codes can be assigned. B. Two codes can be used together to completely describe the condition. C. Only one code can be assigned to completely describe the condition. D. This is not a convention found in ICD-10-CM. 3. In order to best demonstrate the impact of clinical documentation on severity of illness and risk of mortality, which of the following examples is the most effective for physicians in a hospital? A. The latest Medicare provider and analysis review data. B. Emphasize the Medicare requirements for documentation. C. Examples from the hospital's actual cases. D. Explanations on how severity of illness and risk of mortality impact reimbursement. 4. The ultimate purpose of clinical documentation integrity, CDI, expansion and growth is to A. Provide community education to healthcare consumers. B. Create synergy between clinical education and CDI principles. C. Show a direct relationship between clinical documentation and quality patient care. D. Promote CDI functions so that physicians view the CDI staff as value-added service. 5. Which of the following is an example of a hospital-acquired condition when not present on admission? A. Iatrogenic pneumothorax with lung biopsy. B. Iatrogenic pneumothorax with venous catheterization. C. Pressure ulcer stage 2. D. Pressure ulcer stage 3. 6. A hospital is conducting a documentation integrity project for the purpose of reducing indiscriminate use of electronic copy and paste of patient information in records by physicians. Which data should be used to quantify the extent of the problem? A. % of insurance billings denied due to lack of record documentation. B. Number of coder queries regarding inconsistent physician record documentation. C. Results of a survey of physicians that asks about documentation practices. D. Incidence of redundancies in physician notes in a sample of hospital admissions. 7. A patient falls off a ladder and undergoes a right femur procedure. 3 weeks later, the patient returns to the hospital for removal of the external fixation device. The ICD-10-CM 7th character code value should indicate A. Subsequent. B. Sequela. C. Initial. D. Aftercare. 8. When there is a discrepancy between the clinical documentation integrity practitioners, CDIPs, working DRG and the coder's final DRG, which of the following is considered a fundamental element that must be in place for a successful resolution? A. physician and CDIP interaction. B. Coder and CDIP interaction. C. Executive oversight. D. Physician advisor, champion involvement. 9. Which of the following may make physicians lose respect for clinical documentation integrity, CDI, efforts and disengage? A. Inconsistent clinically relevant queries. B. CDI practitioners sending multiple queries to hospitalist physicians. C. The physician advisor champions interventions with non-compliant physicians. D. Providing many lectures, newsletters, tip sheets, and pocket cards for physician education. 10. Patient is admitted with oliguria, pulmonary edema, and dehydration. Labs are remarkable for an elevated creatinine of 2.4, with a baseline of 1.1. Patient was hydrated for 48 hours with drop in creatinine. What would the appropriate action be? A. No query is needed because the patient was dehydrated. B. Query the physician to see if acute renal failure is clinically supported. C. Query the physician to see if acute renal failure with tubular necrosis is supported. D. Code acute renal failure since symptoms are there and documented.